Yodhaha. I am a warrior. Every obstetrician of a country is a warrior. And what is the war with? This is a long battle with maternal mortality. One such warrior Yodha is with us today. Let me take privilege to welcome Professor Dr. Hiralal Konar sir. Welcome, sir. Friends,
Thank you, Dr. Rasmi.
Thank you, sir. Friends, today is the 19th episode of Gyan Pravah podcast. This is a groundbreaking initiative of our respected, beloved President Fogsi, Dr. Sunita Tandulwadkar, Madam. Madam is President Fogsi, and also she is an elect president of ISAR. What can I say about Madam? An epitome of such graceful leadership. Adharam madhuram, vadanam madhuram, nayanam madhuram, hasitam madhuram, hridayam madhuram, charitam madhuram, adharam madhuram. She is such a beautiful support to all of us, to her fellow colleagues, and to juniors who are working with her. She has many applauds, awards, and many firsts to her credit. But more than that, I should say, she is very passionately and very dedicatedly involved in shaping the lives of those who are working with us. She is bringing the best out of them. And Madam is a true leader who knows, who believes in making more leaders, who can eventually make more leaders. A true leader who knows the way. She goes the way and then she shows the way. Madam, it's a great honor for me. It's a great privilege for me to be associated with you. On this occasion, we would like to hear from you, Madam.
Thank you, Rashmi. Thank you for such a gracious use of all the words. Thank you for your kind words. Friends, 8 p.m. Fogsi is with you with Gyan Pravah. Today with 21st episode with Rashmi Kahar. Friends, I know the Fogsians are watching, but at the same time, many more are, because of our social media promotion, probably many more non-medicos are also joining. Believe me, 30 committee chairpersons of Fogsi is the huge strength of the organization. These committee chairpersons work for 3 years with 3 presidents, and they come out with the intelligent, brilliant program for their committee. This year, we planned Gyan Pravah, one night for one person, 30 committee chairperson for 30 days. They are working very hard to get best of the faculty, maybe from an academic field or non-academic field, maybe a sports person, maybe a philosopher, maybe a mental health piece, or maybe a spiritual person. What is more important is they come out with a beautiful dialogue with them, which is always informative, educative. I want all of you to join every night at 8 p.m. and give complete support to my chairperson, who are future leaders of Fogsi. Today we have Dr. Hiralal Konar. Rashmi will be introducing him, but Hiralal Konar is my friend for years together. Since I entered the Fogsi, we know both of them. We both know each other so well. And I'm so happy that Rashmi has chosen the faculty who work extreme in East India and who works tirelessly for a maternal health. So I'm sure Rashmi will bring out best from Hiralal Konar. Thank you so much, sir. And it's honor to be in one frame with you. And always, Hiralal, sir, you have, whether you were the ICOG committee chairperson or not, you have always worked for the organization and for the woman health. So, aapko salam, and Rashmi, back to you.
Thank you so much, Madam. It's such a great honor to work with you, ma'am. Let me take privilege to welcome and introduce Dr. Hiralal Konar sir to the house. As we all know, Sir had been the chairman of this prestigious Indian College of Obstetricians and Gynecologists, that is ICOG, in 2013. It's an academic wing of our Fogsi. He has been vice president of Fogsi in 2008. He had been the editor-in-chief of Jogi from 2011 to 2015 and also editor of Journal of ISOPAR. He's the president-elect of ISOPAR, a teacher of teachers, a great guru, with more than 5 textbooks to his credit, numerous Foxy awards like the Pride of Foxy Award, Foxy Achievement Award, more than 100 research articles in index journals, more than 50 guest lectures, more than 40 chapters written in textbooks, various textbooks. He has been an examiner at various national and international examinations. He has been a principal researcher in tropoblastic diseases in ICMR. He is also a member of Oncology Committee of AOFOG and also Medical Education Committee of SEPOC. It's a great honor, sir, to have you on board today with us. Welcome, sir.
I think,
Ma'am, sir has disconnected.
see, he's in little bit eastern part, but there is someone next to him and he will help him to join.
Sure, ma'am, we will wait.
Meanwhile, Rashmi, can I have a dialogue with you? So what are the points you wish to bring out from Dr. Hiralal Konar?
And basically, it's about the maternal mortality rate. The first point is this. And we all know that you all are the foundation who has laid the foundation. You are the pioneers introducing the maternal mortality rate. So we would like to know in details about this, how this decline in the maternal mortality rate has occurred. We'd also like to talk about the rural obstetrics. Why? Because we observe that there is certain urban-rural divide in our country because of various beliefs, the cultural differences. So has this affected the overall maternal mortality rate?
Okay, wonderful.
Also,
we have faced a lot of challenges than what we are facing,
yes, ma'am.
sitting in a comfortable zone, tertiary hospital. Dr. Konar, can you hear us? Yeah.
Can you hear me?
Yes, sir. Very well.
Yes, yes.
Welcome back, sir. And now we can see you also very clearly. Only someone is talking too much next to you, but we are absolutely good with your voice and the video, sir. Thank you.
Thank you.
So as the protocol goes, sir, I disconnect and I log in with the delegate link, and Rashmi will be with you having a fantastic dialogue, and we all will enjoy listening to it. Thank you once again, sir.
Thank you.
Thank you, ma'am. Thank you so much, ma'am. Good evening, sir.
Good evening. Good evening, everybody. At the outset, I express my sincere thanks, Dr. Resmi, and the leader, the most groundbreaking, dynamic leader, the president of Fogsi, Dr. Sunita Tandulwadkar. Her concept of doing such podcast is the first thing new I could see in the Fogsi, because my association with Fogsi nearly 40 years now. So this is good. Traditionally, we go make some scientific discussion, academic discussion, but we have got very less time to introspect or to review ourselves, what we have contributed to the society, to the nation, to the profession, and to the organization. That's a brilliant idea, Dr. Rasmi. I convey my gratitude and regards to all of you having this sort of session and having the opportunity of coming to this podcast. Now, as you have mentioned that coming to our own discussion of maternal mortality as a warrior in the war of maternal mortality, yes, that's true. If you look into the issue of Indian status of maternal mortality, when I started my career after my post-graduation from PG in Chandigarh, I was posted in a rural medical college, North Bengal, that is in Darjeeling, Sub-Himalayan region. And really speaking, I worked in Nilatan Sarkar, one of the premier institute in the India, Calcutta, and then postgraduate PGI Chandigarh, one of the leaders institute in this world again. And then to a situation, I was a bit depressed. But again, I thought that probably this is the, and my teachers told, this is the situation that you have to work. Don't imagine in a colorful way of doing things. Life is not that easy. Now coming then, giving the basic idea that you told me, in India, maternal mortality was significantly high when I started my career 1985 after my post-graduation. Significant amount of maternal death to the extent of the ratio, we don't need to go for the per 100,000, per lakhs. No, it is the per thousand. So much of so the maternal deaths. I will tell you the. Then for that reason, I thought when I have come to the work, let the world know what I am doing. So to start with, if you look back our own data, that is the sample registration survey of India, that 90s that we had this maternal mortality program that was several thousands. And MDG, the Millennium Development Goal, that was started in 1990 with a target of 2015, targeting reducing maternal death 75%, existing ones, and 75% down. And this Millennium Development Goal ended in 2015. There came this Sustainable Development Goal that started 2015. And by that time of the Millennium Development Goal, we have reached the target. Now, India, looking for that of the Sustainable Development Goal, reduce the maternal death less than 70 per 100,000. Now then, we have already gone beyond less than 100. You know, we are all very happy that our country is progressing further. Now then, that Sustainable Development Goal has got the target by 2030 that we should go below the level of 70 per 100,000. I believe India at the present moment, with this present scenario, significant change, we are going to achieve it. No way we are lagging behind. We should be going there. In this context, what I like to tell, my effort in doing that of the maternal mortality work, well, I told you now, once I joined that institute, I thought they let the world know what I'm doing here. Otherwise, doing things, that's fine. But telling things, allowing the people to know the scenario, that helps much more. That's the reason the India knows that I have worked. My first paper was Rural Obstetrics, a Neglected Tragedy. It was published in the Journal of Indian Medical Association, that time the Index Journal 1992. Main cause, what? Traditional cause, hypertension, hemorrhage, and that of the sepsis. Next paper I published, that is the obstetrics past and present, a comparative analysis of 210 cases of obstructed labor. What was the next maternal cause of death? That was the prolonged labor, obstructed labor, rupture uterus. Really, really dangerous. What was the reason? Reason that of the different reason that WHO and India government has already said that the delay first at the home, delay because of the family members could not recognize the problem, delay in transport, and then delay in the tertiary care center where the patient brought, and then there was a delay in treatment. So this way, next paper I published, that the changing trends in the mortality of septic abortion, another killer. I know in our institute, we changed our policy. MTB law was very strict that time. Now then it has been liberalized. Moreover, MTB services were not available that time. Most of the women fell the victim of quacks. That's the reason many of them died. But septic abortion, we changed the policy, treating the patient and going even to the laparotomy rather than conservative treatment. Now then, this is the 2000 that I came to the platform of Fogsi. I became the chairpersons like you, Medical Disorders in Pregnancy Committee of Fogsi. And I wrote the review article, Medical Disorders in Pregnancy, who should see the woman. This is a tricky situation, you know. Physician feels they are the best. We feel that mother has got significant changes during the course of pregnancy, all the systems basically, cardiovascular system, respiratory system, and that of the hematological, everything, there is a change. So that is best known by the obstetrician. So and patient comes first. I will tell you the another scenario. You will feel what it is that obstetricians is the first person, physicians colleagues should be with us, neonatology colleagues should be with us to help us. Thereafter paper came heart disease in pregnancy, another cause of death. This paper is maximally quoted even today It is under the leadership of, it came in the Fogsi journal. Then I wrote another article, Millennium Development Goal Changing Scenario in India. It is the TOG. This is the Royal College of Obstetricians and Gynecology journal. People came to know there is a change in India. Thereafter, again, when I became the vice president of Fogsi, I published another article, Fogsi study of maternal mortality, the changing trends, significant drop in the maternal mortality. The article came in 2013. Then another area, it is, that time in that institute, working heart and soul, the deputy director of health services asked me, sir, do something of the contraception, sterilization. I said, what you have got? He said, we have got the laparoscopy. But can you give us 3-4 sets of laparoscopy? Because 5 districts of northern Bengal, I did total 22,000 cases of laparoscopic sterilization throughout the northern part of the Bengal. Significant change, and that I published in the Jogi Journal, Indian Journal of Obstetrics and Gynecology, laparoscopic sterilization in the sub-Himalayan region, 22,000 cases. Overwhelmingly accepted and widely read by the people. So this is the scenario that I am going on, and I feel the days are not that far that our data, but again then you imagine our country is not like that of UK or other.
Yes,
we are huge with diversity of our language, food, habit, everything, but we are united together. And this day,
Sir, maternal mortality rate globally, it is better, but we could have done, definitely we could have done better.
Sure.
But
you see,
ours is a nation of diverse population.
That's right. Huge.
Various beliefs and various cultures. So that must be affecting the maternal mortality rate also. I think there is certain urban-rural divide in our country.
Correct.
Do you think it also affects the maternal mortality rate?
Definitely.
Because
There
you
is
have done
definitely
such
something.
immense work in rural obstetrics. So you are the best person to tell this.
You are very right to anticipate this problem, because we are the huge country that by and large most of the states we have improved, but there are some EAG, that Empowered Action Group. There are few states like Assam, Bihar, Jharkhand, Odisha, we are like that. But we are going to change. We are making it a change in the situations of maternal mortality improvement. Now, regarding your point, in the rural obstetrics, I tell you one day, I believe if the audience is there, they will perceive the scenario. Around 2 o'clock in the morning, I was called as a registrar to see a woman that she has come from the periphery in a state of shock, really. And the house surgeon examined her, he could not understand the situation. I could see it is a case of ruptured uterus, hemoperitoneum, and then dead fetus. You imagine the scenario. It is a winter, December, chilly cold there in northern Bengal. And that night I was called and I could examine her. I could see she needs laparotomy, hysterectomy, and to deliver the dead fetus. I called but she needs blood. You imagine that situation I faced. Then I called the house surgeon that asked the relatives to donate blood, because blood is not available unless you donate. Then the husband with a small kid of 3 years girl with the husband. And when we talked to him, we need blood. She needs operation to save her life. The gentleman said, how can I get the blood? I said, you can donate yourself so that we get the blood. In that case, we will get the blood, or you have to pay for it. Then gentleman said, sir, I had suffered from tuberculosis. Am I fit to? I said, definitely not. Then how can I go for this? I said, then you have to purchase the blood. Listen the word, then what he said to me that 2 o'clock in the morning, chilly cold night. The gentleman said, sir, had I had a rupee, I would bought a packet of poison to kill myself and this tiny girl. Imagine this situation. He may be your brother, sister, anything. Then I told my house surgeon, Raja, you get ready with the OT. I am going to the blood bank to donate blood. I will donate blood and come back to the theater. When I was stepping forward, he arrested me. Are you mad? I will donate the blood. You do this thing and I will assist you. And we did. She was saved. This is the scenario that we have passed. This is the rural and urban. But I believe overall all the situations have changed. We are going to improve upon. So there is nothing that there is no boundary. So, and then when I was in Fogsi Rasmi, I raised the issue in the Fogsi platform. Professor S.S. Dasgupta, the president, Dr. D.K. Tang, Dr. S.N. Daftari, all over there, Dr. Usha Saraya. The Fogsi proposed to the government of India to train because that time anesthetists were not available. Good number of gynecologists were not there. Then it was proposal that the MBBS registered past doctors should have a special training in the medical colleges to give anesthesia to do the perform of cesarean section. You see, that much was done and it has improved. We are in the present situation. We must reach the sustainable development goal going below the 70.
This is very inspirational, sir. This is very selfless contribution into the cause of mothers, saving the mothers.
Right.
So in obstetrics itself is
it is not me. Like me, there are many others, warriors. They are battling against the war to win the maternal death, unnecessary, preventable deaths.
Yes, sir. Obstetrics itself is such a beautiful piece of art. It's such a beautiful skill, actually. And we all are striving very hard to promote this skill, to keep this art alive. So I remember one quote from Einstein. He says, the more skill you learn, the more practice you do for one skill, the more you come to know that how much you do not know.
Sure.
And we all are, as an obstetrician, we are striving very hard to keep this art alive. May it be the art of skillful deliveries, may it be the art of delivering difficult, complicated deliveries or operative obstetrics. And you are one of the torch bearers. And what can we do, sir, to keep this art alive?
My feeling is this, that there is a trend now because of several reasons. You see, societal reasons, political reasons, legal reasons, we are a bit scared. So we are often keeping aside our skill and art for a safer pathway, maybe that we are doing more of operative delivery like this. But my feeling is this, India has got its own heritage. The skill of delivery, like, there are several persons, Sir Kedarnath Das, the forceps, Sir Sirodkar, the operations. Their Indian stalwarts are there. So skills should not be forgotten in obstetrics. The other day, I told you, I was in the Vijayawada. There were 8 sessions of workshops, and I was there put in the CTG, I was there put in the shoulder dystocia. Apparently, you will be wondering, what was shoulder dystocia? I have not ever seen, you have not seen, but maybe that 1 in 1,000. But even then, we need to know the art. Even then, we need to go for the assisted vaginal bridge delivery. When it comes in an emergency, we need to have the art of delivering the buttock, delivering the shoulder, delivering the aftercoming head. So skill has to be developed. I feel this, an Indian tradition and the predecessors' skill is there. And if we talk to the women, talk to the family members, we have got all the gadgets are there these days. Ultrasonography, CTG, cardio, everything is there. So if we select a case for that of the appropriateness of delivery and using the instruments, forceps, ventouse, or even the odon is coming, so there should not be any difficulty of safe delivery. So I think we should think of it. Our Fogsi leadership, like Professor Sunita Tandulwadkar, she can think of it that we should be skilled enough. We should have the opportunity. We are doing all sorts of surgery, like laparoscopic surgery, robot. India is a vast country, a huge amount of talents are there. So we should reintroduce that of the skill and obstetrics to deliver our skill and safe delivery, safe mother, safe baby.
Yes, sir, absolutely, sir. And in this regard, you are a great guru. You are one of the teachers who has influenced the lives of many students in this whole decade. So as Sunita Madam always says,
Thank you very much. Thank
she
you.
uses the word always, madhyam, that is medium. A medium or madhyam through which you have reached. This is the great, each sentence, a student of OBGYN will keep a hand, and each sentence of this book is praman for a student of OBGYN. So as madam says, always madhyam, this is a medium. You are a medium who have reached to millions of students through this book. You are a great teacher. And sir, as an orator, as an author, as a researcher, as a teacher, you have influenced many students of this decade. And what do you think, sir, as a teacher, what can influence so many lives? And even I would like to know what influenced you in your lifetime to become such a teacher of such a high caliber. There must be some factors which have influenced you towards teachership that we would like to hear from you.
Thank you very much. This is a very difficult question. And as I often quote you that Indian heritage, probably, well, the teaching is my hobby or passion. We get it from the parents probably. My feeling is this: many good qualities we acquire from our parents. So this way we are brought up in our childhood. And I started teaching when I was a student of class 6. Class 7, 8 onwards, I used to do the mathematics class with my teacher. In my medical college, I used to group teaching, and then I was a tutor. I used to, till today, I teach. This is a hobby I enjoy. And one time, Professor D.C. Datta, one of my teacher, it is his book. It is basically, I am nurturing what he has, the concept, and you will understand that, earlier, probably you have not read. I have read all the, that time it was a trend of books, the British books. That is, I tell you what, we used to read that of the Queen Charlotte, that of the Holland and Bruce, there is the Jeff Coed, and Sir used to say, one day you will see those books are not here. He was such a talented person. You have not seen him. He really did it. His surgical skill is a wonder. Unless you see, you won't believe. By 12 to 15 minutes, even a hysterectomy, without any problem. And this is a talent. Those that we have seen them, we have been reared up by them. So teaching, coming back to our own issue, I feel that if subjects concept is made clear, that's the best thing. No sub-jugglery, simple word, simple thing, and simple understanding that attracts your students, that they are benefited, and you enjoy that teaching. And teaching, we continue it by teaching. One day, Dr. Datta, when I was having the students, when I was an intern, I tell you that I from class 6, and these students used to tell me, address me, sir. Sir, Professor Datta observed it silently. And when the students gone, he told me, that's all good, you are doing fine, but don't ask the students to tell you, sir. I couldn't understand the meaning. What is that meaning? He said, you never know how many of these supersede you at one time of point of life. So it is a mutual friendship learning. Guru Shishya in our country is a learning at one sense, friendship in one sense, Pitamata at one sense. So this is the way of tie that we feel. I think that's succeeded. And obviously regarding the book, as you know, you have enjoyed. We try our level best to make things simplified and to reaching to all the younger students so that they feel, and it goes ultimately, our benefit is the serving the mankind in this country and abroad. Even the English, I spent quite 5-6 years. I took the book there. One of the consultants saying, who has written this book? I said, the Indian teacher, D.C. Datta. Has he ever come to England? No, never ever. How he could write this book? I don't know. So this is the talent. So nothing goes about it. So it is God's blessing, I would say. But whatever you see, you have written Guru and that of the disciple. It is a unique relationship, and that we continue, and that continues.
This is such an impactful work, sir. It is
Sure.
going to stay here. Yet, Sujay Chandra.
And
Yes,
moreover,
sir.
once I travel to all the conferences, I take part in discussion, and they enjoy it. They ask many questions. Apart from this discussion of topic, they go beyond that. So I enjoy this. This is the way. And if I feel that this is not clear, I say that I will tell you later on. I will go through more of it because there are many talents. They will put in some questions that you don't know all the time. So I tell them honestly, I will wait. I will go through this again and I will communicate you, give your phone mobile number. That I do. So this is, and I get many mails also. So this way we tend to maintain our quality. That Sunita says, originality, hard work, no exception. That we do.
Sir, what would you like to advise or say to the current age obstetricians, like the new generation of obstetricians? Would you like to say or advise something to them?
I think the one that is the doctor-patient relationship. So that if the relationship is true and on the basis of trust and faithfulness, there is no such problem. Because I see when you are calling me, I was seeing my patient. I do practice. I am in a hospital teacher. I operate. I teach everything I do. So it is a mutual relationship. Risk explanation, not to scaring them, supporting them. Often I get the medicines, I give them all whatever medicines I have got. Sometimes I have to make them free. So this way you develop the relationship, because patient needs your support, we need to support them. And once they know you, they will be with you so throughout your life. Now then, I am Sunita may be same, you may be same. I am looking after the third generation. I have seen the daughter when she became the daughter-in-law. I have seen her mother. I have seen her grandmother. So this way we are our family. Professor Datta. I don't know whether you know the relationship with Professor Datta. Do you know Professor Datta relationship with me? He is my father-in-law. He is my teacher. He is my father-in-law. His photograph is there in this clinic. So this way, so coming back to our one point, relationship with the patients. As a social person, obviously society, going with them, looking for them, going there for their support, that we have to do. And students, definitely, they are your next generation. Like your son, daughter, they are your next. They will be keeping you alive. As I today, Dr. Tandulwadkar, Dr. Gyan Pravah, Dr. All these, Dr. T. Datta, we remember, Dr. K. and the Forces, we remember. So this is our Indian heritage. We tend to maintain it with our genuinity, sincerity, and the hard work. So there is no such alternative. And truthfulness, I feel so. And there should not be any problem.
That's in our social scenario, do you observe, sir, there's some change in doctor-patient relationship
There is
over the
something
years?
over the years. There is a break between. I don't know how it is, but my feeling probably, if we are genuine in our heart and take them with us with all the explanations that this government has also made the provisions, that explanation, communication skill. You know, the undergraduate has been started the communication skill, so that the young people. So I am saying something as a consultant. My postgraduates, my students, they should have the same tune, so that we in a group discuss how we are going to reach the problem. Because this morning, one patient, she is willing for spontaneous vaginal delivery, but she is unwilling to allow you to examination. Then what do you do? I have to get the family members, the woman, and that of the team members, and make a discussion. Then they agreed, "Bhaiya, wo chhod do, chalo operation kar do." So if she cannot allow us, labor is a duration of 6 to even 10, 12 hours. So one has to bear with us. We would be guarding with her. We would be supporting her. But again, this way, I think there is enough scope of breaking the understanding, communication, to have the mutual understanding, so that the relationship is maintained. That is important as a professional, medical professional. So also as a teacher, if I don't know, often I say, I will tell you later on. Give me some time. Or if I know, definitely I will support them in all the best way. So probably that helps in the long way.
Yes, sir. Basically, having a very kind and a sympathetic attitude
Sure,
and
sure.
understanding
That is
attitude
no
towards the
alternative, no
patient
alternative.
is going to help in the long run, sir.
That's the reason the curriculum of MBBS has already been changed. Government of India has made it. Medical Council, that they should know. In fact, during my time, my teachers were mostly from the England, UK trained. As you know, Calcutta is trained. And when I was house surgeon, my professor J.S. Mandal, have you talked to the patient? Have you talked to the relatives? Have you explained them the risk? So we have learned that way. But again, then we need to communicate till today, maybe more, guiding the young generation how to go with the patient in understanding and the treatment.
Yes, sir. So we are marching towards the end of this our beautiful conversation. I would like to say something, sir. There is a very great saying. Guru na prapyate yatta nanyatrapi hi labhyate. Guru prasadat sarvam tu prapnyotteva na samshayaha. Howsoever you try, without the help of a guru, you are not able to achieve anything. But if a guru,
Our belief is
if a teacher, your teacher blesses you, you will be able to achieve everything, whatever you want in your life.
Sure.
So that's the importance of a guru, a teacher in our life. And sir, it was a great honor, sir, to have today with us. It's a great privilege to have you with us today, sir. I'm very much thankful to Dr. Sunita Madam, Dr. Sunita Tandulwadkar,
Sure.
for giving us
The
this
leadership,
opportunity.
dynamic leadership that she has made this plan, and the innovative idea, the exceptional one, it's really, if this program is attended by our younger generation, they will be benefited. How the teacher-student relationship, that you have raised all the issues, how the maternal mortality has evolved, and how we have improved upon with the dedicated silent works over the years. Now, I didn't imagine that my works will be one day will be appreciated in a meeting. I couldn't imagine, but I have written all these things. Time and again, I have gone through this. So really, really, I am all indebted to you, Madam Sunita, for this concept and making this known to all, that of this silent service.
Yes,
What
sir.
you were designed as warrior of a word in preventing
Yes.
unnecessary, unpreventable maternal deaths, non-neonatal deaths. Really, really great.
So, thank you very much. It was so nice to have you with us.
Really, I have enjoyed.
Savior of mothers, I
Monday, my
would like to
regards.
say.
Yeah.
And thank you
Thank
for
you.
gracing my first podcast, sir. Thank you very much, sir. Thanks.
Thank you. Great.
Thanks.
Thank you.